Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professors Stephanie Lucas and Terry Walholick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
Hello, everyone. Thanks for tuning in to Dose of Knowledge Pharmacy Podcast. Today, our podcast is What Do Community Pharmacists Do? Community pharmacy is more than counting pills. We'll start by introducing ourselves, and then we'll get right on to what community pharmacists do. My name is Jackson Burgess, and I'm a student pharmacist at St. Louis College of Pharmacy. My community pharmacy experience includes 4 years as a pharmacy technician at a Walgreens in Iowa. I worked at 2 different locations. One was super busy, high-traffic store, while the other one was a much smaller store with the same patients coming in each month.
Hi, my name is Matt, a second year or P2 student at the St. Louis College of Pharmacy. I've gotten community pharmacy experience in a few different pharmacies, Rite Aid, Walgreens, and in a compounding pharmacy.
Hello, my name is Molly, and I'm a student pharmacist at St. Louis College of Pharmacy. I have not worked in a community pharmacy before, but got experience at one this summer on rotations at Beverly Hills Pharmacy. Here is where I learned that community pharmacists do not just fill prescriptions, but also give shots, educate patients, and many other things.
Hi, my name is Reese, and I'm currently a second-year pharmacy student at the St. Louis College of Pharmacy. I have a little over a year of experience at CVS. This past summer, I worked at a local independent pharmacy for my rotation in a very small town in southern Illinois.
Did you know that more than 90% of Americans live within 5 miles of a community pharmacy, and patients visit their community pharmacies 12 times more frequently than their primary health care provider?
Community pharmacies rank among the highest in routine interactions within healthcare, yet many people still don't know exactly what a community pharmacy consists of or see the importance of pharmacists' role that keep these pharmacies running. Keep listening to hear more about what your local community pharmacist does.
Community pharmacists serve as a vital gateway to primary care and public health, offering face-to-face pharmacist expert care to assure safe and effective medication use. Community pharmacists also optimize care by providing educational consultations, medication safety and optimization services, chronic condition management, patient empowerment, wellness services, care coordination, and other services.
To start this podcast, we sat down with Dr. Knipe, a community pharmacist at Walgreens, to get some insight into a real day in the life.
Hi, my name's Claire Knipe. I am a director of pharmacy and retail operations for Walgreens. I have 155 stores across Missouri and Illinois, and focus on the whole store, but specifically on pharmacy operations, and support for our teams.
Yeah, thank you for joining us today. So, what does a typical day look like for you at work?
So for me, my typical day is supporting my field leaders, both healthcare supervisors and then district managers, in their support of our stores. So I work through them to support all team members in the stores, but specifically with our pharmacists. So a typical day for a community pharmacist would look a lot like what people might imagine. A decent chunk is going to be around filling prescriptions, which is the legacy thought process around community pharmacy, right? Why we're in the profession. But then going into that, there's other parts too that are clinical services. So immunizations, testing, adherence tasks like MTM and making sure patients stay adherent. There's also relationships with patients, answering questions, educating them on new medications or questions they might have. And then there's educating healthcare professionals. So working with doctors and making phone calls to them and working as a partner with them as well.
Yeah, that's really interesting. So, what roles do you feel that you play as a community pharmacist for patient safety and health?
So our community pharmacists, if you think about it, are really they have a huge seat at the table when it comes to quality and patient safety and healthcare overall. They are the gatekeepers to prescribers and to patients and to make sure they get what they need. So every prescription they fill, there's a thought process within it And part of that is quality. Part of it is compliance, but the major part is quality, making sure our patients get exactly what they need when they need it, not getting too much more than getting less or too much is the key there. So they play a huge part in patient safety because they play that gatekeeper role. And so at my level, my job is to support them in that and to support my field leaders in supporting them in educating and training, making sure that we are keeping quality top of mind, that we are watching for trends and making sure that we don't find any specific mistakes that are happening over and over again, and that we're supporting operations so that our pharmacists can have time to focus on safety and quality.
Is there a reason you chose community pharmacy? And then what do you think is the most rewarding part of being a community pharmacist?
So I stumbled into community pharmacy. I'll say that. I started with Walgreens when I was in my first year at Stillcop, so in 2005. And I wasn't sure at the time that that was for me, but I learned to love it over the years. So to me, community pharmacy is the core of our profession. I always say that pharmacists wouldn't exist without community pharmacy. So as the profession has expanded and there's many opportunities now, community pharmacy is still the biggest need and the core. And so I learned to love it over the years. And really, it goes into what the most rewarding part of my job is, and that's helping people. So I think, every time that we fill a prescription, we are focused on quality, right? And making sure that the patient gets what they need, making sure they understand what they're taking, things that their doctors may be able to do, but maybe don't have time to do, or maybe don't have the subject matter expert qualities that we have. So for me, it's helping people and really being a pillar of the community where people can come to you with questions and concerns and just being able to help them.
So, from your experience in the community pharmacy, what's something that you wish patients knew coming in that would help them to see what all community pharmacists do?
Yeah, it would be great if we would have glass where they could see everything that was going on, right? Or even kind of had an insight into what a pharmacist goes through to get to that point in their career. Just to get and hold that license is a huge amount of work. And so I wish patients, and I think we're doing a better job of explaining this now, but I wish patients had a better understanding of how much goes into filling a prescription. I think, unfortunately, sometimes in community pharmacy, we use that word retail, which hurts every time I hear people say it, and we get compared to other retailers, but we're not. Yes, we have a front end. A lot of our community pharmacies have a front end where there's a retail store, but at the back of the business, and the most important part of the business, we're a pharmacy, and every prescription we fill, it doesn't take seconds. It takes minutes, and sometimes it takes hours because we have to connect with the prescriber. So I guess I wish sometimes they just knew how important it would be to what all goes into a prescription.
Okay, and then our last question today is if you just want to explain briefly how you communicate with other healthcare professionals and then what impact this has on patients.
Yeah, so our community pharmacists that are in the pharmacies in the stores working are connecting with healthcare providers at all times. And that could be something as simple as vaccine history and wondering if we need to give this vaccination to a patient. It could be as simple as a dosage came over that doesn't make sense. And it could be something around adherence. Hey, we can't get in touch with the patient. Do you all have a different number for them? Is there somewhere else that I can contact them? So it really is a partnership, and we call it a trio. The healthcare provider, the doctor has a part, the pharmacist has a part, and then the patient has a part. So that trio connecting is really important. And at the center of that is the patient and making sure that they're safe and have what they need.
Great, well, thank you so much for joining us today.
Thank you for having me.
Dr. Knight brought up some amazing points. Community pharmacists serve as gatekeepers to patient health and safety. Their communication with other healthcare professionals keeps you from getting medications that are dosed wrong or simply ineffective for your health concern. Dr. Knight mentioned that if patients could see through a glass wall of everything that we do, they'd better understand the process of having their medications filled. As a pharmacy student who works in a community pharmacy, I get to see all of the services that we provide. Dr. Knipe listed a few of these, and we'll cover them more in depth in the following sections. Keep listening to hear about a variety of these services, or use our show notes to jump to a certain section that you want to learn more about. We'll start with how important community pharmacists are in navigating insurance.
Pharmacy technicians and pharmacists also play the role of insurance experts. We run medication orders through the right insurance, look for cheaper alternatives, and even find coupon cards to lower costs. Remember, pharmacists don't set your copay. Your insurance company does. but pharmacists do their best to help you pay the least amount possible. Sometimes we call the physician's office to switch to something that's covered, or we check eligibility with your plan. Have you ever had a prior authorization before, Molly?
I have. My insurance didn't cover the medication I needed, even though my physician said it was the best option. I was worried I'd have to pay hundreds out of pocket. After waiting about a week, I got a call from the pharmacy saying it was ready and covered. It felt like magic happened behind the scenes.
Well, most of that magic actually happened at the pharmacy. When insurance flags a medication as needing approval, either the pharmacist or technician contacts your physician to provide reasoning for the medication. Once the physician provides that, we submit it to the insurance to try to get it covered. Sometimes it's quick, but other times it can be a real challenge. I once spent 2 hours on the phone with an insurance company to get a patient's medication approved, but seeing the relief when they didn't have to pay a huge bill made it all worth it.
To learn more about these topics, reference the What to Do When You Can't Afford Your Prescription podcast, as well as the What the Public Needs to Know About PBMs in our mini-series.
Besides insurance just covering medications, insurance also covers vaccines, and vaccines are a crucial part in community pharmacies.
Picture this. You just accepted a new job offer, and at the end of the interview, they tell you that you need an updated tetanus shot. Your physician doesn't have any open appointment slots for a month. Looks like you can't start that new job next week.
But hold on. A pharmacist can not only prescribe vaccines, but also administer them. And this can all be done at your local community pharmacy. With flu shot season here, many community pharmacies like CVS and Walgreens do walk-in or online same-day appointments to get vaccines. For the year 2023 through 2024, the CDC estimated that pharmacies have given roughly 32.2 million COVID-19 vaccines compared to 3 million in medical offices.
That's crazy. Community pharmacies play a major role in vaccinating the public. It's super convenient that I can go into a community pharmacy. As long as I give them my information, they can figure out which vaccines I'm eligible for. If you're interested in learning more about vaccines, head on over to Dose of Knowledge and listen to the podcast titled Vaccine Mythbusters, Measles Outbreak. I remember when I got my tetanus shot, that hurt so bad. Like, I had terrible muscle aches in my upper arm, and it was just like, also I would get chills at night. That also same thing happened with my COVID vaccine, and it was nice that I could actually talk to a pharmacist, and then they could recommend me something over the counter.
Prior to pharmacy school, I had no clue what to get when entering the pharmacy aisle at Walgreens. There are so many medications, brands, and product types that it was super overwhelming. I didn't want to grab the wrong thing.
Yeah, I felt the same way. Seeing my pharmacist answer questions and provide recommendations for patients made me wish that I knew these resources existed before. In pharmacy school, we spend hours upon hours learning about over-the-counter medications, like what's most effective, what interacts with what medications, what someone can take with certain medical conditions, and much more. I had no clue that young children can't take Pepto-Bismol. The bright pink color always caught my eye.
When I visit my parents, I notice them taking over-the-counter medications incorrectly all the time. I remember my stepdad has an eye drop that he got at the pharmacy, and he keeps it in the fridge, and I'm pretty sure that eye drop expired in 2019. But you can't blame them for when no one has ever educated them on it. At the St. Louis College of Pharmacy, Professor Dr. Gilmore once said, over-the-counter medications are the most dangerous medications because everyone has access to them.
The misuse of over-the-counter medications causes 178,000 hospitalizations each year. These medications are very effective, and many of us use an over-the-counter medication on a daily basis. But that little bit of education from a pharmacist could save anyone from misuse.
You may just save yourself a headache or even money by going to talk to your pharmacist about what over-the-counter medication is best for your concern. If you have a certain medication in mind, don't be afraid to verify it with the pharmacist, just to ensure your safety.
I've seen patients in the past come into the pharmacy with a medical concern that they believe they can treat over the counter. Luckily, once they asked my pharmacist, they were able to get referred to proper treatment. If you want to learn more, reference a podcast about over the counter every patient should have. I recently found out 2 years ago or so that naloxone or Narcan became over the counter. What is naloxone used for, Reese?
Naloxone is used to reverse opioid overdoses.
Oh, For some reason, I thought that was something you had to get at the actual pharmacy. I didn't know you didn't need a prescription for that. Also, nicotine replacement therapies or like the nicotine gum, like they sell that behind the counter. I meant like without a prescription at my Walgreens. How does that work?
Yeah, a lot of different dosage forms too. Like you can get gum, patch, and the great thing about that being available readily in pharmacies is you can ask your pharmacist what might be best for you when it comes to any side effects that you should watch out for or any other education points that your pharmacist is schooled and well equipped to answer for you.
Quitting smoking is one of the hardest things a person can try to do. Overcoming nicotine addiction is hard, and patients often feel all alone when they try to quit.
Yeah, that's true. I know some people in my life that are dealing with nicotine addiction, and it's pretty hard to actually get out of that cycle there. Your community pharmacist can help you decide which nicotine replacement therapy is best for you. They may ask a few questions, such as what time did you smoke your first cigarette today? How many do you smoke each day? Or whether if you find it hard to not smoke in certain areas or when sick. With this information, they can actually help you create a plan to quit.
If you want to learn more about naloxone, there's a podcast all about it. It's called Naloxone, Why It's Important and Why People Should Carry It.
When they're putting you on like a nicotine replacement therapy, is that something that needs to like, do they have to verify the dose or anything for that? Or can you just like kind of like get whatever dose and start off with that?
No, pharmacists absolutely have to check all of that for you. Some of those questions that pharmacists might ask that we went over, that's going to determine the dose, which includes the strength and the route if it is going to be gum or a patch or something like that, to make sure that it's safe for each patient and that also it's going to work to help you quit smoking.
Have you ever wondered why your pharmacy can't just slap a label on it? While it may be frustrating to wait a few extra minutes for your medication, pharmacists are working hard to ensure there are no errors with your medication.
Yeah, so the very first person that sees a prescription is your community pharmacist. Whether sent over by your physician over the computer or you drop it off by hand, every medication is verified by the pharmacist. With the information that they have, your pharmacist ensures that the dose your physician chose matches the medication being prescribed. They make sure that how often you are told to take it is correct, and they reference your profile to check for interactions with other medications you might be taking. After all of this is checked, that is when it's sent to be filled by the other pharmacy staff. Pharmacists are very efficient. There's just a lot of steps they take to ensure patient safety and health.
The very last person that sees a prescription is also your community pharmacist. When the medication is done being filled, your pharmacist is the final check before the prescription leaves the pharmacy in your hands. They make sure that the pills in the bottles match what the physician prescribed. I remember one time at Walgreens when I was working there, the pharmacist opened one of the vials that wasn't even marked, like they were just giving us like a bottle that was straight from the manufacturer. And then before they went to like go give it to the patient, they opened it and there was already pills taken out of it and it wasn't even marked. And we almost gave this person a half-empty bottle. Your community pharmacist is the main person in our healthcare system that prevents medication errors. They ensure the right person, drug, dose, strength, route, and check for interactions with your other medications. Wait, speaking of new medications, have you guys ever been prescribed a controlled substance? These medications carry a high risk of abuse. Sometimes they are prescribed after like a major surgery or even wisdom tooth removal. That's when I had them. They have many laws about when or how you can often fill them.
Have you ever wondered how different pharmacies were able to monitor controlled substance medications? Since they can't see into each other's systems, how can they tell what patients have picked up recently?
I know back in my pharmacy, we had a whole program for that. Pharmacies played a role in managing the prescription drug monitoring program, often referred to as PDMP. It's when a patient is prescribed a controlled substance and picks it up at the pharmacy. This information is then entered into a large database across all pharmacies, and it keeps track of what medications the patient picked up and when they picked it up.
Substance abuse is a pretty big and common issue, and the problem with this is many patients don't even mean to become addicted to opioids or other controlled substances. They misunderstand the risk of the medication they're taking, and then they slowly begin taking the medicine more than prescribed. The PDMP is a tool to help combat this. Pharmacists can reference this website to see a patient's history of controlled substances and help prevent filling medications too early or allowing patients to get the same medicine from multiple different pharmacies.
The PDMP isn't only a tool meant to ensure pharmacists abide by the law. It can help identify patients at a high risk for abuse so that pharmacists can try to intervene and educate these patients.
That's great to know. It makes me feel better as a patient knowing that someone's looking out for me.
During COVID, your community pharmacist was also looking out for you. They were definitely key players in the pandemic, not even just with looking out over your prescription profile, but for testing as well.
Did you ever have to get COVID tested during the pandemic? Chances are you probably pulled through your local community pharmacy's drive-thru and did a rapid COVID test.
During the pandemic, community pharmacists were in the spotlight. They provided rapid on-site testing for the virus. They also administered thousands of vaccines. They help patients manage bothersome side effects of COVID. This is a great example of the services that your pharmacist can offer, but it's not all that they can do.
Yeah, I know sometimes it's depending on the pharmacist, the actual pharmacy that you're at, but my community pharmacists, they also provided other on-site testing. They can take your blood pressure, your blood glucose, A1C levels, cholesterol. They also test for influenza or strep throat, and even can do depression screenings to help initiate a referral or a psychiatrist. That's why they're a good bridge between a provider and the pharmacist, because then they can actually talk to the patient and refer them to what care they need. These services can benefit people who are unable to do certain at-home testing such as blood pressure or prevent patients from waiting at an urgent care for multiple hours.
So having these tests done is great, but what do you do with the information? It's often confusing for people who have no medical education. Before pharmacy school, if you told me my blood pressure, I would have had no clue what the numbers meant. But don't worry, your pharmacist can help with this too.
Every time you go to the physician, your insurance is billed for a copay, and this price can vary across insurance plans, but it can be very expensive for some people. This is usually why patients don't see their physician as much as they should, and they often wait until the issue is very severe.
In a sense, pharmacists are the only doctors that you can ask for advice without having your insurance billed. While the education in pharmacy school is more based on actual medications and less on diagnosis, pharmacists are still very knowledgeable about a variety of diseases. They can help you decide whether you should seek medical care or can try to solve the problem with lifestyle changes or over-the-counter medications.
Exactly. Many of our lectures in pharmacy school focus on exclusions for self-care. Basically, we are taught the way to manage issues without needing to see a physician, but we are also taught which patients are past this cutoff point and need to see a physician. Pharmacists can help manage many things, but they can also help you decide whether you should see your physician.
Now, you should have a better understanding of what all your community pharmacist can do. We covered a lot of topics, but we really hope that you learned something that will help you as a patient in the future.
Your community pharmacist studied to earn their doctorate degree. They went through an intense curriculum to become the most educated healthcare professionals on drug dosing, how medications work, interactions with other medications, and various disease managements. If you have questions about a medication, your community pharmacist is the best resource.
Community pharmacists also see more than your regular physician. They have direct access to a profile of all the medications you have recently picked up. They can inform you of side effects you may experience from taking certain medications together, and they can give you tips on how to manage or avoid these. Your pharmacist is prepared throughout their education to counsel and instruct you, the patient. They go through courses that highlight how to effectively educate patients to ensure that you are taking the medication correctly so that you see the best results with the least amount of side effects. They can teach you how to use an inhaler, test your blood pressure, and load and administer insulin.
Community pharmacists know certain dosing instructions that may exceed insurance limits, and they understand which medications are preferred by insurances. They know the best coupons for brand name medications to help cover the copay, and they spend hours on the phone trying to bypass issues so that you can get your medicine.
After listening to our podcast, we hope that you are inspired to visit your local community pharmacy. They are such a vital resource for you as a patient. Your community pharmacist wants to help because they care. On our behalf, we ask that you support us in a few ways.
Be nice to your community pharmacists. They work hard to ensure that your medication is accurate and effective.
Use the resources at your community pharmacy. Your pharmacist is an expert in medications,
and they want to help you get your medication and save money.
Take advantage of the variety of services that your community pharmacist offers. They provide vaccinations, counseling, can show you how to use various medical devices, and more.
Everyone, please pay attention and vote for representatives at the local, state, and federal level that support pharmacists' rights to provide healthcare services. The more your pharmacist is allowed to do, the easier you can receive care. That's your dose of community pharmacy for the week. No copay required.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.